Welcome to this information on cervical decompression and fusion surgery at the Mater Private Hospital in Dublin. There is a team of experienced professionals here ready to both guide you through your surgery and to help you with your recovery. We will care for you throughout your stay, but will encourage you to participate in your own care and recovery. Working together and providing you with as much information as possible in advance of your surgery has been shown greatly to improve the success of your surgery. We want you to experience the excellent care available here at the Mater Private and be able to return to the active lifestyle you deserve and can enjoy. This video will provide you with information about what to expect before your surgery, during your hospital stay, and after you are discharged. It is intended to give you basic information which will guide you and help you prepare for your surgery. Cervical decompression and fusion surgery varies from patient to patient. If you need more specific instructions or more detailed information about your surgery, your surgeon will take you through this. Let's take a look at the spine and the surgery you are having. Cervical decompression and fusion surgery is a procedure used to remove pressure on the spinal nerves or the spinal cord that may be caused by disc herniation and/or degeneration of the spine. A bone graft is usually inserted with instrumentation to stabilize the vertebrae. The incision may be in the front or the back of your neck. Most people who have this surgery are discharged from hospital 1 to 2 days after.
Hi, my name is Sylvia. I am the orthopedic nurse here at the Mater Private. I have been caring for patients for many years, and there are always lots of questions about what to expect. I know coming into the hospital can be a daunting experience, so I will take you through what to expect when you're here and then some tips and advice for you when you go home to help your recovery. For most of my lovely patients, going home is the best part of their stay. So, let's start with preparing for your surgery and hospital admission. With some simple changes to your lifestyle and forward planning before your surgery, you can positively influence your surgery outcome and recovery. Diet. A healthy, balanced diet will help with the healing process. Smoking. Doctors strongly recommend you stop smoking at least 8 weeks before your surgery. As a smoker, you have a much higher risk of serious complication both during and after surgery. It slows down the healing process. If you find it hard to stop smoking, you should at least try to cut down. Advanced preparation. To make it easy for you when you get home, have everything set up and ready before you go into hospital. Here are some suggestions. Stock up with groceries. Prepare some meals in advance and freeze them. Once you are home, delegate the task of cooking to someone else if you can. Leave your bed comfortable and clean with fresh bed sheets. Arrange for someone to help look after your family, house, garden and pets while you are recovering. Set the time on your heating. Ensure your home is well lit to avoid any potential slips, trips or falls. Ensure you have help with any household activity that requires bending, reaching or lifting. It might be advisable to take items you use regularly out of the cupboard and leave at hip height so that you are not reaching or bending into cupboards. If you live alone and need extra support, our medical social work team can tell you about the support available in the community. Within the month of surgery, you will attend the preoperative assessment clinic here at the Mater Private. We call it the PAC for short. The clinic is to make sure that you have no health issues that might delay or cancel your surgery. You will meet a nurse who will go through a number of checks and tests with you. These include health assessment and medication review, blood pressure, pulse, height and weight check, blood and urine sample test, MRSA swabs, ECG of your heart, X-ray of your back and possibly a chest X-ray. In some cases, the anesthetist may also meet you at this clinic. If you have any test results or scans from another hospital in the last 4 months, bring these with you. Before you leave the clinic, we will go through the instructions for your surgery, including the date and time and the information about fasting and medication. The appointment can take 3 to 6 hours in total. So if you would like, please bring someone with you to the appointment. Here is a list of items to bring with you. Loose, comfortable clothes which are easy to get on and off. Shoes and slippers. Think safety, not style with your footwear. They should be flat with non-slip soles and have a good back with solid support. If they have laces, make sure they don't untie easily. Toiletries. Any personal effects to make your stay comfortable. Ensure you have an adequate supply of medication you are currently using and bring it to the hospital with you. You will be admitted to the hospital on the day of your surgery. Remember to follow the instructions about fasting and medication. Before you leave home, have a shower or bath. Pay special attention under the arms and around the neck. Once you arrive, a nurse will check your details, take your observations. These are blood pressure, oxygen level, pulse rate, and breathing, and go through our theatre checklist to ensure that everything is ready. Finally, you will meet with your surgeon, who will make sure that you fully understand your procedure and that you are happy to be taken for surgery. First, you will go to theatre reception area and from there to anesthesia.
Hello there, my name is Dr. Agnes Hayes. I'm one of the consultant anaesthetists working here in the Mater Private Hospital, and I or one of my anaesthetic colleagues will be looking after you for your spinal surgery. We'll be seeing you during what we call the perioperative period. We'll be seeing you preoperatively in the preoperative assessment clinic. We'll be delivering your anaesthetic on the day of surgery, and then we'll be looking after you and monitoring you very closely when your surgery is completed, while you're on the surgical ward or while you're in the intensive care unit. I think it's important that you know there's a very wide spectrum of surgical procedures for spinal surgery, and there's also a very broad range of indications for that surgery. So it's important, therefore, we individualise your care and we formulate a care plan that's suitable for you. In our experience, it's important also that you don't benchmark or compare yourself to others who are having similar sounding or type of procedures. In this manner, then, you'll achieve the best possible outcome. We'll see you at the preoperative assessment clinic here at the Mater Private Hospital. Ideally, you would attend about a month in advance, but mostly we see people about a week or two before their surgery. At the clinic, you'll be attended by both a nurse and an anaesthetic doctor. We use the opportunity at the clinic to conduct a full review of your medical history, both your past medical history and your current medical history. We also collate information that we have on you from other specialists you may be attending or from your general practitioner. We use this information then to formulate a unique intraoperative care plan for you for the day of surgery. In some instances, we may need to conduct some further tests. We may need to delay your surgery for a period in order to optimise your medical condition before surgery. In our experience, it's a very good idea if you bring a family friend or relative with you to the preoperative assessment clinic. This will help you to retain all the information that we provide you with, and will be, of course, of benefit to you during your stay at the hospital. On the day of surgery, then, we'll provide you with an appropriate anaesthetic for your medical condition and for the type of surgery you're having. We are fully aware that you may be very anxious on the morning of surgery, but we'd encourage you to leave the responsibility for your care with us on that day. During the surgery, we'll be intensively monitoring you from the point of view of your neurology, your cardiovascular and respiratory system. Once the surgery is completed, then you'll be transferred into the recovery area for a further period of intensive monitoring. And from here, then, we will decide whether you need to be transported to the intensive care unit, the special care unit, or the surgical ward. Immediately post-operatively, our focus will be on ensuring that you've recovered completely from your surgery and from your anaesthetic, so we'll be intensively monitoring your vital signs. In a later period then, our focus will be on mobilisation, pain relief, and ensuring that there are no post-operative complications. At this point, I would just like to say we look forward to working with you and meeting with you during the course of your treatment here in the Mater Hospital for your spinal surgery. Please feel free to ask any questions at any stage. And I do hope that the information we provided with you today is of some use. Thank you.
When your surgery is finished, you are returned to the recovery area until you come around. Here, you are monitored by the nursing team who make sure that any pain is under control and your observations are normal. These are blood pressure, oxygen level, pulse rate and breathing. You will be lying down with your head elevated by 30 to 40 degrees for 24 hours following surgery. If you have had a multi-level fusion, you may be taken to intensive care for monitoring. Your surgeon will have discussed this with you before your operation. Otherwise, you will be taken to the ward once recovered. When you're awake, you can slowly start to eat and drink again. Sips of water first, followed by something light and soft like tea and bread or scrambled egg. There will be an IV line in your hand or your arm, and you will have a drain tube in your neck for 24 hours. This is to drain any extra fluid from the wound. Controlling pain is a very important part of your recovery. While pain is to be expected, it is not something you should have to suffer, as it will slow down your recovery. If you feel in pain, do let us know. It is easier to control and relieve the pain before it gets too bad. Don't wait and tell it like it is. Do not try to brave it out. Let's now have a look at what to expect in the days following your operation. You will normally be allowed to get out of bed on the day of your surgery. This is the best way to get your muscles moving and to prevent post-operative complications. You must have a nurse or physio with you when getting out of bed for the first time, who will show you how to move your head and neck safely and correctly. You are at increased risk of fall after surgery, so please wait until the physio or nurse is with you. Some patients may experience difficulty swallowing following surgery. This is due to swelling, also known as dysphagia caused by the operation. Do let the nurse know if this is happening. Some patients might be fitted with a neck collar to help keep the neck in position. We will let you know if this is needed for you. We recommend you start your deep breathing and leg exercise as soon as possible. Your physio will show you how to do this. The day after surgery, the drain tube will be removed. You will have to wear white head stockings or compression stockings for 4 weeks following surgery. These help to prevent clots from developing. 24 hours following surgery, you will be allowed to lay flat without your head being elevated. You may also sit if it is comfortable to do so. Start with short periods of 20 minutes and gradually increase the length of time sitting. Take care not to bend or twist your neck excessively. Let us know if you are prone to constipation, and we will provide you with a laxative if necessary. Next, our physiotherapists are going to talk to you about starting to move after your surgery.
We in the physiotherapy department work as part of the team to facilitate best outcomes from your neck surgery. We do this by getting you mobile as soon as possible and by instructing you on the do's and don'ts for when you go home. Most people are ready for physiotherapy the day after surgery. However, it's important that you do not get up on your own the first time, as you could get lightheaded and fall. So please wait for the physio or the nurse to come. When we come to see you, we get you out of bed. When you're able, we get you to walk first on the flat and then on the stairs. We'll also show you some gentle neck exercises that you can do at home. To start with, let's take a look at the easiest way to get in and out of bed. Bend your knees, reach your arms across your body and roll onto your side. Allow the weight of your arms and legs to roll you over. Once on your side, swing your legs over the edge of the bed while at the same time pushing yourself up into the sitting position. You can do the same in reverse to get back into bed. Let's have a look at this. Sit on the edge of the bed, lie down onto your side and bring your feet up onto the bed. Roll gently onto your back, or you can lie on your side if you prefer. To rest comfortably, some patients find it helpful to place a pillow under their knees when lying down. If on your side, you may also find it helpful to place a pillow between your knees. At the end of this video, we're going to show you the exercises that you'll need to do for the first 6 weeks once you are home. For now, Sylvia is going to talk to you about getting ready to go home.
Most people are discharged 1 to 2 days after surgery. You will need to arrange transport home, and if it is a long journey, allow time for breaks so you are not sitting for more than 20 minutes at a time. Remember, once you are home, do not lift, pull or drag anything heavy for at least 12 weeks. At this point, you should have a follow-up appointment with your consultant who will advise you whether or not these instructions should stay in place. Prolonged sitting should be avoided. Remember to wear your compression stockings for 4 weeks following surgery. Before your discharge, your wound will be checked and the dressing changed. A waterproof dressing is left in place, covering your wound. After 5 to 7 days, you can change the dressing and check the wound for any potential signs of infection and clean if it is necessary. You will be shown how to do this before you leave the hospital. Remember to replace the dressing. After 2 weeks, you can remove the dressing completely and the steri strips used on the wound will wash away with your next shower. Let's go over how to check your wound. Wash your hands with hot soapy water for at least 30 seconds. If you have one, use a disinfectant hand gel as well. Use the back of your fingers to check if the wound is hot or feels tender. Check wound for any signs of oozing, redness or an unusual smell. If you notice any of this, you may have an infection, so please call us or your GP. Finally, I have pulled together a checklist for you to go through before you leave. Check you have your wound care instructions, extra dressings, prescriptions particularly for painkillers and laxatives, your own medication returned, contact number in case of any problem and possible complications, details about your follow-up appointment. Once you are at home, if you notice any of the following, call us or your GP. High temperature or feeling generally unwell, problems with your wound, oozing, redness, sore to touch or smell, loss of bladder or bowel control, arm weakness or change in sensation, severe headache or sensitivity to lights, shortness of breath or difficulty in breathing, chest pain. Once you are home, your exercise plan will be really important in supporting your recovery and improving your outcome. Next, our physios will take you through your discharge exercise program.
Before you leave the hospital, we will take you through the following exercise program designed to support your recovery. These exercises are to be followed for the first 6 weeks following surgery.
Posture. Posture, while not an exercise, is an important part of your recovery. To maintain good posture, it's important to keep your chest, shoulders and tummy relaxed. Don't brace yourself as you might have done against the pain. Relax the upper body, keeping the chin gently tucked in. When standing, stand up straight, relaxing the chest, tummy and shoulder muscles. When sitting, sit back into the chair with your back well supported in the chair, relaxing the chest, shoulder and tummy muscles. You may be tempted to brace your neck while moving to control pain. However, research shows that relaxed movement is far more effective.
Deep breathing. Deep breathing should be started immediately after surgery. It helps to keep your lungs clear, and importantly, research shows that deep and slow breathing has a very positive impact on pain, and so can be used to relieve any painful episodes. In a comfortable position, breathe in deeply and slowly as though you are filling your tummy with air. Now let the air out like a balloon deflating, allowing your body to soften. Spend at least 10 to 15 minutes doing this relaxation technique each day. Some patients find it helpful to start and finish the day like this. Ankle pump exercises. Move your feet up and down while lying in the bed. This is very good for your circulation until you are up and mobile.
Chin tuck. In sitting, gently tuck your chin in and feel a stretch at the back of your neck. Hold for 5 seconds and relax. Repeat 5 to 10 times, 3 times a day. This exercise can also be done in lying. Shoulder rolls. Gently roll your shoulders forwards and then backwards. This helps relax your neck and shoulder muscles. Repeat 5 to 10 times in each direction, 3 times a day. Shoulder shrugs. Gently move your shoulders up towards your ears. Hold and then drop down as far as is comfortable. Repeat 5 to 10 times, 3 times a day. Trunk rotation. In sitting, cross your arms across your chest. Rotate your upper body to the left and then to the right. Keep your head in line with your shoulders. Repeat 5 to 10 times, about 3 times a day. Postural re-education. Some patients develop poor posture as a result of neck pain. This can be corrected by strengthening the shoulder blade muscles. In sitting or standing, keep your upper arms and elbows close to your body. Gently squeeze your shoulder blades together, keeping your shoulders down. Hold for 5 seconds and release. Repeat 5 to 10 times, 3 times a day. Remember, once you're home, do not lift anything heavier than 5 to 10 kilos for around 12 weeks.
Walking is one of the best exercises you can do in the first 6 weeks following your spinal surgery. Research shows that early progressive activation gives the best outcome from surgery. However, everyone progresses at a different rate, so it is important to listen to your body. For walking, wear loose, comfortable clothes and supportive footwear. Start walking on the flat for the same amount of time you were doing in the hospital. For example, a 5-minute continuous walk at a comfortable speed. Do this twice a day. Add in another 2 to 5 minutes every few days to your walking. Be guided by your comfort. Aim to walk 30 to 40 minutes within 4 to 6 weeks of your operation. You are allowed to add in slopes after 2 weeks. There's advice on sitting, driving, return to work and return to sport in your booklet that is appropriate for your surgery, but please discuss this with your consultant. You may have your ups and downs for a while, that's normal, but if you get back active, stay positive and take charge, you're far more likely to get a good result.
Thank you for listening to this information. We hope it has been informative and that you feel more comfortable about what to expect in the coming weeks and months before, during and after your surgery. Remember, you can always ask for help by calling us if you're concerned or worried when you go home. Good luck and we look forward to seeing you during your stay.